So you decided that osteoporosis was a big problem through research or because you had patients that suffered from it?
Well, everybody learns, in healthcare, in medical school, that osteoporosis is a major cause of both morbidity and mortality. People have a spinal collapse or a hip fracture, and they could die of a hip fracture in the hospital soon thereafter. It can impart their health very negatively.
Hmm.
So, and it's very high prevalence in our society. For women who live as long as 85 years, the risk of having a hip fracture is 30%,
Hmm.
which is 10 times the risk of having breast cancer, let's say. So it's really a significant expectation. You're probably going to develop weak bones, and you may fall and have a hip fracture, which could then impact your potential life and result in some major interference with your happiness and health.
Absolutely. And I remember you telling me also that hip fractures and falls are a huge cause of death, that many people actually die from them.
Correct. Right.
Like a huge population of the elderly.
Right. It's something that we have to really be concerned about. And that's why we don't put rugs in the houses of elderly people. They can trip over the edge of a rug. You're having a smooth floor. And there's a lot of safety precautions that people take with footwear. But in any case, I'm here to talk about the fact that drugs, because Americans use drugs for everything. Instead of getting out of the salt, getting rid of salt out of the diet and eating a healthy diet, they take blood pressure medications. Instead of eating they look for doctors to solve all their issues.
My doctor friends tell me this. They say, people just want a pill, Jenna. So that's what we have to do.
They want a pill. And it doesn't work for osteoporosis because when you take the bisphosphonates, and the major one that is very common is called Fosamax, which you've heard of that one. It has an effect to moderately strengthen the cortical bone, which is the exterior coating of the bone, but not the trabecular bone, which is the center of the bone. So in doing so, shifting growth to the edge of the bone, it can reduce hip fracture rates by a small amount, but it may be increasing risk of mid-femur fracture, or the center part of the bone, which has less cortical bone on both sides, and it can cause osteonecrosis of the jaw, which can be a death of the jawbone. And there's other risks, including risks to the heart, like atrial fibrillation, and it can cause irritation to the esophagus, like esophageal, more like gastritis and esophagitis. So then people are taking the bisphosphonates, and they can cause problems with their heart, like atrial fibrillation. And when you stop the drug, the atrial fibrillation is not going to go away because these drugs last in your system for so long. So it could permanently damage your heart.
And atrial fibrillation, that's an irregular heartbeat,
The irregular heartbeat that people need now heart treatments for.
Okay.
And they may have to be on blood thinners the rest of their life, which then further the risk of having a hemorrhagic stroke or a bleed, or which the blood thinners can further irritate the digestive tract. And then, if you're taking these drugs that irritate the digestive tract, maybe the doctor puts you on Nexium, Prilosec, these drugs, Propulsive, whose are our proton pump inhibitors, which suppress acid production, so people don't feel reflux. And those drugs have a black box warning for increasing risk of heart attacks. But those drugs that suppress acid also increase risk of osteoporosis and create more calcium loss in the urine. Because of the low acid environment, you don't absorb calcium as well and digest protein as well. So one drug causes certain risks, and people take another drug for the side effects, and that causes other risks. And when people are on blood pressure medications, acid suppression medication, they're on bisphosphonates like Fosamax, and it's increased their health problems, not solve them.
Right.
People don't want to hear the truth. Here's the reality: is that your muscles and bones strengthen and weaken together. And if you have osteoporosis, then you have weak muscles. And people fall not just because of weakness of the bone, they fall because the muscles are weak and the person loses proprioception and balance with aging. Now, us Nutritarians encouraging people to eat a healthy diet, we're trying to encourage people to exercise to maintain muscle and bone mass, and to keep strength training exercises throughout their whole life, which includes side-to-side motion with change of direction, kind of like skipping out to one side, stopping and moving back in the other direction. We're anticipating the type of falls people make when they get older and they fall sideways on their hip. And we're actually training them to be able to move sideways and move back in the other direction quickly, to train the body to be able to catch itself and build the nerve impulses that you need to change direction to protect against falls, which improves balance and proprioception.
Yeah, and as I was doing your exercises, because I even do them too, and I just wanted to point out, not only are they good for preventing falls, but they're actually just good for muscle building in general. So I was sweating at the end, I was heavy breathing, and I was really doing those side to side proprioception movements, front and back, and
Yeah.
the quick changes that really can save the day if someone is going to fall or hurt themselves.
Right. And when you take your foot and you move your foot out to the side or underneath to the side,
Hmm.
then you're like used to this quick movement. You know how to step your foot out wide if you feel off balance. You're a little off balance. You get the foot out wide, you push yourself back.
Right.
People aren't used to that. They trip, they just go back. They're not used to moving their leg out fast.
And
So we're
there,
practicing that. You know what I mean?
absolutely, it can make all the difference. And
Right.
also, there's people who are so into fitness, and there are people that then do zero fitness. And there's really this happy median that you can fit into where you're doing these exercises a little bit every day that can save your life, right?
Right. So we're talking about daily exercise, right? And you got to start it at mid-age.
Hmm.
You know, you can't, optimally, we're exercising our whole life.
Our whole life.
And we're maintaining, because we want to maintain good muscle and bone mass with aging.
Hmm.
And then, of course, the American diet, which is low in minerals and high in junk food and all the accessory minerals in a nutritarian diet, and the features of a nutritarian diet help maintain bone strength and bone density with aging. And let's maybe hit on that maybe for a little bit.
Wait, before we get there, I just want to touch on you threw a lot of stuff about medication at us very fast. So I want to make sure I understand everything.
Okay.
So we're prescribed these medications, or you can be from your doctor, that help with osteoporosis and can protect your bones. But what it sounded like when you said it was that it only protects the superficial layer and that you could still have a severe fracture, but it gives you a little bit of protection, but not as much as you'd like.
Correct. And also the side effect profile isn't worth it.
Hmm.
The side effects, and also the studies show that exercises causes more than double the protection against hip fractures compared to taking medications do. So regular daily exercise is twice as effective as medication for protecting hip fractures.
And you don't have to hurt your heart.
Right, and you hurt your digestive
or your
tract.
jaw.
Right, you're right. So you don't take those risks.
Hmm.
And of course, you add eating right to that and all. And the other cause of osteoporosis is medications of hip fractures, or blood pressure medications that can cause people to become lightheaded, and sleep medications, anti-anxiety medications, and other medications that can cause people to become lightheaded or woozy. Or so, in other words, drugs are a major cause of hip fracture, besides the fact that benzos and sleep medications and blood pressure medications and even diabetic medications, all those other drugs also increase risk of hip fracture. So all the things we're doing, getting off the drugs, relying on lifestyle medicine, is the real way to go if you want to see true protection.
Is that because the medication causes lightheadedness and you can fall easier, or is it because the actual medication is likely to weaken your bones?
It's mostly that it leads to less poor balance and lightheadedness, yes.
Which
Yeah.
that is hard to deal with if you're off balance, or I've
Yeah.
seen people just be
Right.
really wobbly, and you want to make sure they're protected because falling can kill you. It's really scary reality.
Yeah, falling can kill you.
Yeah. Okay, so last question on medications is just the blood pressure medication you also said can contribute to osteoporosis. I just find that really fascinating.
Because the body sets the blood pressure at a sufficient level to adequately oxygenate the heart and the brain. But because high blood pressure causes an issue with brain damage and kidney damage, doctors then lower blood pressure to a more protective range. And in doing so, you lower diastolic blood pressure too low, and then the heart and the brain could be underperfused, and therefore you can become, more
Wobbly.
more wobbly, more lightheaded, more weak, more fatigued,
Wow.
and possibly fall down.
Yeah. And even for the people that do suffer from, high blood pressure, you can resolve with diet, sleep. There's a lot of natural remedies and even supplements that could help with sleep. Like there are more natural options where you don't have to rely on medication.
Right. We
And you
try
get-
to use the lifestyle medicine, which includes exercise and proper sleep techniques.
Mhm.
Meditative or dream. We talk about sleep techniques, and we
Mhm.
also talk about what you're saying right now is some helpful natural therapies that don't have side effects that aid people without putting them at high risk, like drugs do.
Yeah, I just want people to know they have options
Yeah,
and they
right.
don't have to immediately default to a pharmaceutical drug, which is important.